Good afternoon. Our lecture today is about international healthcare management. Today, I want to tell you more about the Millennium Development Goals, the so-called MDGs, and the Sustainable Development Goals, the SDGs. And both Millennium Development Goals and Sustainable Development Goals are from the United Nations, and they were signed by countries, member countries of the United Nations. Now, just a definition about the United Nations, what they are. They are also known as the UN. It is an intergovernmental organization, and intergovernmental means there are more governments and they are cooperating and they work together, the governments of different countries. And mainly the UN is known for international peace and security in fragile countries, in war countries. And their task is to develop a friendly relationship among nations and to achieve international cooperation. And in case of conflicts, they should be the center for harmonizing the actions of nations. So the UN member states are the 193 sovereign states, and they are members of the UN. That is of today, 2019. The UN is the world's largest intergovernmental organization. Now, the Millennium Development Goals, they started in 2000 and they ended in 2015. So we talk about the MDGs, and they were in the past. They are not currently used anymore. The MDGs, they are or were 8 international development goals. Development goals which were established by the United Nations during a Millennium Summit and after this summit in 2000. And they were adopted by all member states. Now, I said we are 193 nations, but when they were signed, the MDGs in 2000, there were 191 nations. You see here, you see the 8 goals. The first one is eradication, extreme poverty and hunger. These 8 goals, they were followed and signed by all member states. So every member state said, we want to improve all 8 goals. So the second one is achieve universal primary education. The third one is about gender equality and empowerment of women. And the fourth one is reduce child mortality. The fifth one is improve maternal health. And goal number 6 is combat HIV, AIDS, malaria, and other diseases. And you see, 4, 5, and 6, they are related to health. And number 7 is ensure environmental sustainability. And number 8 is global partnership for development. Now, the MDGs, they had as a goal to halve extreme poverty rates, and that means half of the poverty which was in 2000 when they started. It should be half of it in 2015. That was the goal. And also halting the spread of HIV/AIDS That means not to increase HIV/AIDS patients, and also providing universal primary education. That was were the goals, and they were agreed by the world countries and the development institutions. So the UN is working with governments, social societies, and other partners to build on the momentum generated by the MDGs. So it's not, the UN itself is not, they are not, they don't have really power or force. They only have force and power when the governments sign those documents. And as all countries signed the MDGs, so that meant they were following the MDGs, all countries. That is important. Now, as we said, the MDGs ended in 2015, but there were the Sustainable Development Goals which followed those MDGs, and the Sustainable Development Goals started in 2016, and they will end in 2030. Now, what you can see here is also the goals of the SDGs now, and now they are 17. Remember, before they were less. Now we have 17. Before they were 8 only. In the Sustainable Development Goals are also called the 2030 Agenda, where the Sustainable Development Goals were signed. So some people don't talk about the SDGs, but about the 2030 Agenda. And they were also signed by all nations who were our member states in 2015. And they also had as a goal, they have peace and prosperity for people on the planet now and in the future. So at the heart of those SDGs are the 17 goals. And they are, which is a little bit different now, they call for action by all countries in a global partnership. And they are also, they should improve the situation in all member countries. It's not only in the poor countries, or in developing countries, but in all member countries, the situation should be improved. And it should be ending poverty and other deprivations, and they have to go hand in hand. That health and education and inequality will be improved or reduced. Now, they have, the 17 SDGs have 169 targets. That means those 17 goals, they have sub-goals. And they have a balance between economy, social questions, and ecological dimensions. And all together, they have to go all together to improve the whole situation. And you can read more if you want to read more about SDGs and their sub-goals. Here you find the link and you can read more about it. Now, let's go back just to see the single goals. Goal number 1 is no poverty. Then we have 0 hunger. Number 3, and that is important for us, is good health and well-being. And now you see it's only 1 goal. Before we had 3 goals. It was 4, 5, and 6. Now we have 1 goal, number 3, and it's about good health and well-being all in 1 goal. And then we have quality education, again, gender equality also. We have clean water and sanitation, which is also very important to developed countries, to industrialized countries. Affordable and clean energy, also for industrial countries, very important. Decent work and economic growth is also a goal. Then we have industry, innovation, and infrastructure. And goal number 10 is reduced inequalities. Goal number 11 is sustainable cities and communities. So sustainability is has a much higher impact, and therefore they are called Sustainable Development Goals. Sustainability was not so much an issue with the Millennium Development Goals. They were also, it was also a question, but now with the Sustainable Development Goals, sustainability is much more important. Now, goal number 12 is responsible consumption and production. And goal number 13, climate action. That will be a very important point in the next few years. Then life below water is also very new, and life on land is a new goal. And then we have goal number 16, which is peace, justice, and strong institutions. And this goal number 17, the last but not least one, is partnership for the goals. So there have to be many partners going in the same direction, and also interactions between the different goals. It's not only one isolated goal, but it is there will be cooperation for different goals to reach them. Okay, let's go to our goal number 3, which is about ensuring healthy lives and promote well-being for all ages. Now, here with goal number 3, because it's about health and which is in our healthcare management very important, we will look into the sub-goals. Sub-goal number 3.1 means by 2030, reduce the global maternal mortality ratio to less than 70% by less than 70 per 100,000 live birth. So it will be very important to strengthen health care for pregnant women. So it will be antenatal and postnatal will be an issue to look at. Point 3.2, it is about ending preventable death of newborns and children under 5 years of age in all countries, and it should be at least as low as 12 per 1,000 live births and not higher, and under 5 mortality at least as low as 25 per 1,000 live births. So when it comes to neonatal mortality, it is very closely connected to maternal mortality, because if a mother dies, very often the child also dies. And that could be during birth or after birth, the child could die. So point 3.1 and 3.2 go very close together. But of course also under 5 mortality, that means it has the prevention of diseases for children under 5 is also a big issue in the SDGs number 3. Now 3.3 is about AIDS, tuberculosis, malaria, and neglected tropical diseases, which is new. Neglected tropical diseases were not an issue in the MDGs, and it's also about hepatitis, waterborne diseases, and other communicable diseases. So they should not even be halved, but they should be ended. That is the goal. But probably we will not reach it by 2030, but it should be our goal. Point 3.4 will or is about reduction by 1/3, again, premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being. So non-communicable diseases, something like it can be disease like diabetes, and premature mortality, that means babies can die when the mother has, for example, diabetes. And therefore, we try to eliminate or to reduce by 1/3 those non-communicable diseases. Now, point 3.5 will be about strengthening the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. And that is very important because it's not only treating sick people, but prevention is also very important. So point 3.6 will be about to have half the number of global death and injuries from road traffic accidents. So this is also about prevention. This is not only treating people who had an accident, but to try everything to prevent an accident. Then 3.7 is to ensure universal access to sexual and reproductive health care services, including family planning, information and education about it, and the integration of reproductive health into national strategies and programs. This will also mean less women will die during pregnancy, because nowadays in developing countries, in areas where people are very poor, women get pregnant 1 year after the other, and that means the more often they get pregnant, the higher the risk is that they will die during pregnancy, because they don't have the strength anymore to recover from the last pregnancy. So therefore, this is also a very important point to have, to do family planning, and to teach girls, women, and men about sexual and reproductive health care. So this is also very important. Point number 3.8 is achieving universal health coverage. And that means universal health coverage. We will have a separate lecture about it. This is to provide health care to every person in the world, so to have a good healthcare service. And it means also including financial risk protection. That means health insurance, access to quality, essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Now, 3.9 is to reduce substantially the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. So this will also be a prevention. This will not so much be what to do if that happened, but it will. It is also part of it, of course, the knowledge what to do with patients who had contact with chemicals and water and soil pollution, but it is much about prevention also. So then there are two other points. It is 3.A. So strengthen the implementation of the World Health Organization Framework Convention on Tobacco Control in all countries as appropriate. And by the way, the World Health Organization, WHO, is a sub-organization of the United Nations. So it belongs to the UN. And 3.B is about support the research and development of vaccines and medicines for the communicable and non-communicable diseases. And it's so important because they affect the developing countries. Vaccines are very often not affordable for poor countries, for poor patients who have no health insurance. So it is very important that those people, those poor people in developing countries, get access to vaccines and to medicine. And this will be in accordance with the Doha Declaration on, it's a special agreement, and it's about public health also. And this agreement affirms the right of developing countries to use to the full provisions in the agreement on trade-related aspects of intellectual property rights regarding flexibilities to protect public health and in particular provide access to medicines for all. That means intellectual property rights, which is very often in industrialized countries, and poor countries have no access to it because medicine and vaccines are developed and produced in industrialized countries by pharmaceutical companies who have the intellectual property rights. And it has to make clear that poor people should have access either at a very low price or for free to medicine and to vaccinations. And point 3C is about substantially increased health financing and the recruitment, development, training, and retention of the health workforce in developing countries, especially in least developed countries and small island developing states. So least developed countries are the poorest of the poor countries. And in those countries, it is so important that health workforce, like health workers, nurses, doctors, they will, the training of those health workers has to be improved and it has to be made available. And point 3D is about strengthening the capacity of all countries, in particular in developing countries, for early warning, risk reduction, and management of national and global health risks. And here it is very important to provide and improve global and public health. And that is also about training, so that health worker understand what is a global health risk. It is about statistics, it is about diseases, it is about a combination of human health, veterinary health, and environmental health or environment, and it goes together with health. And this is called One Health, and it is a part of global public health. Now, in the next slide, we see the difference between the MDGs, and here from 2000 to 2015, and here we have the SDGs. And you see that with the MDGs, we cover less of those so-called 6 essential elements, and this, for delivering the SDGs. And the 6 essential elements are dignity. That means dignity which will implement end poverty and fight inequality. Then it's about the people, to ensure healthy lives, knowledge, and the inclusion of women and children. That has to be strengthened. Then it's about the planet. The planet has to be protected, and our ecosystem for all societies and all our children has to be protected. Then it is about partnership. It is about catalyze global solidarity for sustainable development, partnership between different countries, between countries from the north, like industrialized countries, and countries in developing countries, either in sub-Saharan Africa or also in some countries in South America and in Asia. So that is there has to be a partnership, and it is about justice. It is about promoting safe and peaceful societies and strong institutions. That is important. It is about governments, good governance, no corruption. That is justice also, and at the end, there should be prosperity. That means grow a strong, inclusive, and transformative economy. And when you look at the MDGs, you see only the first four elements were covered by the MDGs. By the MDGs, for example, justice and prosperity were no issues. They just didn't exist. And after developing the SDGs, following the MDGs, the members who developed those SDGs from different countries, they realized that justice and prosperity are also very important. Otherwise, we will not reach the first four, elements. Now, the positive aspects of the SDGs are that they cover environmental, political, and economical challenges. So this has changed in regards to the MDGs. And the global and international issues are addressed more comprehensively than with the MDGs. So all those points mentioned here are in regards to the MDGs, who were from 2000 to 2015. Now, the SDGs are universal, where all the countries are equally involved in the implementation. So it's not only the poor countries, the developing countries, but really all countries, all 193 countries of the UN, they are now involved in either solving the problems or solving the problems in their own countries and also in other countries, in other nations. So they will cooperate. And all 17 goals are interconnected with each other. That means not every goal is by its own and has to be solved by its own, but we have to solve all and look at all 17 goals in order. We cannot just leave one or two goals behind, because we need to solve all 17 goals, and then we will reach the goals in total. And also the climate change and national resources, gender equality, peace is very important, because without peace you can forget almost all the other goals. And it is important that there was an international commitment of ending poverty, a commitment which every country signed. And all 193 countries had a comprehensive vision and frameworks, which includes the issues that affects all countries and all goals. We have to be one big community, and we have to work into one direction together, and then we will solve the problems, which is not always easy, because we have countries where we don't have peace, where there is war. We have to look and find solutions, not only within the country, but we have to find solutions, international solutions, to end wars. And number 8, which is out of the 16 positive aspects, It is very important to focus on empowering women and girls. It is so important to that all women and girls go to school, that they will not fall behind. Women and girls have to learn how to read and write and how to calculate, because once women will understand the world better, and they will learn how to feed their babies, what is important during maternity. When they learn that, then many problems will be solved already. And there is no go that girls will, there are some countries where girls are not allowed to go to school. That is a no-go, and we have to do everything that girls and women will be allowed to go to school. There is also a priority on inclusiveness and environmental sustainability. Inclusiveness, that everybody will be member of the community, but also the environmental sustainability is important. That we do not, for example, when we have forests in South America or forests in Europe, and we do not eliminate those forests just because we need wood. We have to look at the sustainability. We have to replant trees, and that is only one idea. It's also about water. We have so much plastics in the sea. We have to do something, because sustainability means also we give the environment to our children and grandchildren the way they can live a healthy life. And if we continue doing what we are doing right now, our children and grandchildren will not have a healthy life, and that is not sustainability. So, next point is about the multidimensionality of SDGs, where development is seen as a system rather than enhancement in individual conditions. Yes, we should look at all the countries, at all the people, and not only as us as an individual. And broad and ambitious nature of all goals and their targets, that goes together with sustainability, so that our planet will continue in a healthy way, in a good way, and we will not kill that planet. And a high level of data disaggregation. This will help to understand the local, national, regional, and international status quo of different aspects in more detail. What does it mean? It means we have to collect data, and we have to analyze this data, and especially not only in healthcare. We can show that when we work with a geographic information system, we can collect data. We understand better where are the big diseases, where do we have HIV, measles, or other diseases, and we can look into those data at the national level. Then it's more about public health, but we have to look at it, as we already mentioned, in global public health. So not only in one country, it is important to understand it. It is important to understand it globally, and it is about cross-border healthcare, because, for example, we will have zoonotic diseases. That means from animals, diseases from animals which will switch to human beings. Like, for example, it can be malaria. When there is a fly biting a person, and then they get a disease. That is a zoonotic disease. It is about Ebola. Ebola is a zoonotic disease. And animals will cross borders, and we have to understand how they cross borders, where they cross borders. And that is, so we need more details. And nowadays, with all the internet, with digital devices, with smartphones, with tablets, where we can collect data, it is easy to do. It is not like 50 years ago, where it was so difficult to understand many diseases. Nowadays, it's easier. We have to do more research, and we have to understand better how diseases are connected. But of course, it's not only about diseases, but in our case, it's important for us. And we have inclusive and participatory goals. Different goals are participating with each other. So, and we also distinguish hunger from poverty. That means nobody should be hungry because of poverty. So we have to eliminate poverty, and then we will eliminate hunger. And it's very important within the SDGs to do enclosure of peace building and governance related goals. So our goal should be no wars anymore. And the SDGs also focuses on generating local resources for funding the goals. So local resources means not only from international organizations, money coming from there, but also locally resources should be available for funding the goals. Now, there is a video. It is about Sustainable Development Goals Explained, Good Health and Well-Being. And you find that video. You can go, when you go to CaseIO, there is a link. It's called Video SDG 3. And there you can watch this video, and it gives you an explanation. It's a short video. It gives you a better explanation again from a person from the UN about the SDG 3. I will talk now about some tasks which you should do, because that gives you a better understanding of the SDGs, of the MDGs, sorry. Now we are talking about the MDGs because I think you should look into the MDGs, because there we already have results. With the SDGs, we don't have results yet because they only started in 2016. So, task number 1 is describe the improvement of goal number 4 of the MDGs in Sub-Saharan Africa. And for that, there is literature, and it is about the impact of the Worldwide Millennium Development Goals campaign on maternal and under 5 child mortality reduction. Where did the worldwide campaign work most effectively? And again, here you have the link, and here you find the literature. You should write your answer as a Word document. And please, when you write that Word document, always add in the document your first and last name to the document, and then upload it to CaseIO. Which is with this link, you have access to CaseIO, to the case where you should upload it. There you find a folder which is called MDGs and SDGs, another folder called Students, and there you have improvement of goal number 4. And you can upload your Word document to that folder. And there is another task which you could or should do. It is about compare the achievement of the MDG Goal 4 of Ethiopia and of Sierra Leone, and explain the differences and challenges. Suggest a solution. First, you compare those 2 countries, and you find all the literature and the links here. You have two documents you can read. And then you should write again a document. It's explained where you should upload it here, where you, in that document, you compare the achievements and with between Ethiopia and Sierra Leone. And it's very important to me, suggest a solution for the country where you think it the MDG goal 4 and now the SDG could be improved. Why could it be, or how could it be improved in one country where it is really necessary? So yes, these are the tasks, and we will discuss your suggestions and your documents you uploaded in one of the next lectures in Trakirchen. Thank you very much, and goodbye.